here. Can I have your attention, please? Tēnā koutou katoa. And in terms of our well received and well listened to both here with the audience and off-site, the first speaker that we're having from the department in this new arrangement is Dr. Hera Cook. And she's a friend and colleague. She's been back in New Zealand for 5 years after training in the UK. And she now shifted into our street. So she's a friend, colleague, and neighbour. Her area is the history of women and sexuality, about which there is, on both counts, probably not as much in the curriculum or on research as there should be. She's the author of The Long Sexual Revolution and English Women, Sex and Contraception, 1800 to 1975. So over to you, Hera, and I look forward to what you're having to say.
Thank you, Philippa. Certainly a pleasure to be a neighbour. Okay, so female cosmetic genital surgeries, or as I'm going to say, FCGS, initially emerged in the 1990s. Cosmetic surgeons claim that patients find they improve appearance. Right, our man has stayed just for this.
This one's going a bit better. There you go.
Okay.
Have that one there.
Thank you. Thanks, Lucy.
Can you hear that better, Lucy?
Female cosmetic genital surgeries, or FCGS, initially emerged in the 1990s. Cosmetic surgeons claim that patients find they improve appearance, comfort, and sexual function. There has been a unique rejection of FCGS, with researchers opposing them in several disciplines and American and Canadian medical bodies issuing statements rejecting them. This paper describes how conditions emerged to make demand for FCGS from Anglo-American women and girls possible in the period from the last third of the 19th century until the 2000s.
You need to bring it closer to you.
Oh, right, okay.
No, it's just...
Right, okay. The emphasis in the paper is on the USA and the UK. Nice to see you all here. Historians tend to stare at the paper in front of them. Okay, let's try that. Is that better? Okay. So, demand for FCGS from Anglo-American women and girls in the period from the last third of the 19th century until the 2000s. The emphasis is on the USA and the UK, which have influenced Pākehā New Zealand practice. Pākehā and Māori sexual behaviour have differed, and without research into Māori sexual practice, it is not appropriate to speculate about their experience. Though it is worth noting that the racial impact of cosmetic surgery, including skin whitening creams, nose jobs, etc., is as important as the gendered impact in countries such as South Korea, India, and Argentina. Okay, so until the 1990s, cosmetic surgery to improve the appearance of female genitals was all but inconceivable. There is now surgical literature, including developing techniques, a substantial textbook, and survey data claiming to provide evidence of the positive outcomes, including improved sexual function of a range of genital surgeries. These surgeries remain relatively uncommon. There were only 10,250 labiaplasties performed in the USA in 2017, compared to the 220,000 nose jobs or the 209,000 eyelid surgeries. That figure probably underestimates the numbers because gynecologists also provide these surgeries. Nonetheless, it's unlikely to be more than, say, 25,000. This is, however, a public health issue. Girls' and women's preoccupation with body insecurity and appearance anxiety has been found to interfere with cognitive functioning and academic performance. It contributes to eating disorders and obesity. A recent report on this did not include sexuality as an issue, But body insecurity plays an obvious role in undermining sexual confidence, which increases vulnerability to sexual abuse. FCGS is only the most extreme instance of the extension of these anxieties to the genitals, an area of the body in which appearance did not used to be considered relevant. For many people, the obvious explanation is the growth of online pornography, or perhaps the growth of pubic hair grooming and removal. Existing research shows, however, that women's awareness of online pornography is not high, and that professional counsellors find that the young women who are coming forward with anxieties about their labia have little exposure to porn. And the normalisation of pubic hair grooming is open to the same questions as the growth of FCGS. Why has a particular genital look lent itself to being broadcast to a wider audience? Why has that audience responded with such anxiety about their own genitals that they are willing to endure the pain of pubic hair removal or to remove sexually responsive tissue, as happens in labiaplasties? The method used in this historical research was to draw up a set of criteria that had to be met in order for female demand for FCGS to emerge. Women had to be aware of their genitals, comparison of their genitals with those of idealised other women had to be possible, and a means of altering their genitals had to exist. This paper considers changes since around 1900 that have altered experience of the genitals, including sexual beliefs and practices, the role of hygiene, the images of genitals that were available to women, including their own, and the role of competition in the lives of girls and women. A wide range of sources, some used by me in earlier research projects, provided knowledge of girls' and women's everyday experience of their genitals. However, first I will comment on labiaplasties, or the cutting away of excess tissue from the labia minora. These two pictures come from the first textbook on these surgeries. I would like to draw your attention to the word normal, as in normal external genitalia in figure 3.5. That is not normal external genitalia, that is genitalia that has been surgically trimmed. On the other side, we have labia minora that are described as hypertrophic. These are, in fact, normal labia without surgical trimming. Note the symmetrical appearance of the one on the left, the low colour of the small labia defined as the norm. In both images, there's severely trimmed pubic hair and relatively colourless anus, which is also something the surgeons are encouraging. And there's greater colour in the hypertrophic, so-called hypertrophic labia. So this is the kind of appearance that they're attempting to convince women is the norm.
And no pubic hair.
And no pubic hair, yes. Okay, the female organs involved in sexual pleasure, reproduction and excretion are packed tightly into a small area with major bodily processes overlapping and impacting upon the others and strong muscular support. In addition, there is a fundamental, strongly positive interaction between emotions and these organs or body parts, which is central to sexual arousal. Societal attitudes to female sexuality remain deeply contradictory, and medical knowledge of women's sexual response remains partial at best and often confused. If we return to the Kinsey report on sexual behaviour in the human female in 1953, he found that 84% of the 2,727 women interviewed who had ever masturbated, so that was actually something under a third of his total female sample, did so using labial and or clitoral techniques. Women reported stroking or rhythmically pulling their labia minora. From a negative perspective, when performing clitorectomies to prevent masturbation in mid-19th century London, the surgeon Isaac Baker Brown brutally excised the labia. So in both these instances, we find a very clear belief that the labia are sexually responsive or part of sexual response. Surgeons who undertake labiaplasties in today's society argue that removal of labial tissue does not reduce sensitivity, and according to their research, women's sexual response is improved. However, once the tissue is sliced off, it has, obviously, no sensitivity. So their claim must be that labia do not contribute to sexual response. Kinsey et al. Found out that both the outer and the inner surfaces of the labia minora are highly sensitive to tactile stimulation. As sources of erotic arousal, the labia minora seem to be fully as important as the clitoris. During coitus, the entrance of the penis may provide considerable stimulation for the labia minora. At the lower end, the labia minora continue inward to form a broad funnel-shaped vestibule, which leads to the introitus of the vagina, that is the entrance, and is as important a source of erotic stimulation as the labia minora or the clitoris. The labia minora also react strongly during sexual arousal. They are highly innervated along the edge, and sexual arousal leads them to engorge and double or triple in thickness, then change colour from pink to intense red when orgasm is imminent. Now this is another picture from the surgeon's repertoire. So those are possible cuts into the labia minora on your left, and that's a before and after photograph of the operation. So what you're left with after these operations is a kind of nibbled up little line alongside each where the labia minora used to be. In 1975, an article on labiaplasty discussed the possibility that masturbation had caused the multiple changes in the labia minora of two women. This suggests that the involvement of the labia minora in sexual pleasure was also evident to modern surgeons. However, there has been a complete disappearance of this concern and of anything that implies the labia minora are erotically sensitive tissue in the surgical literature that I've been able to find since the 1990s. Now, both surgeons and the female patients claim that women experience an improvement in sexual satisfaction as a result of the slicing away of their labial tissue. This is a survey that was used to produce the most substantial research on this. As you can see, the questions aren't extensive. There's been a substantial critique of surveys as a means of collecting data on sexuality from a range of people, particularly Leonora Teffer, who is a female activist and academic concerned with female sexuality. These female claims that result from this survey suggest that perhaps there is some form of placebo response, and also that the belief that her genitals are being observed can undermine or even destroy a woman's fragile, conscious connection with her embodied and emotional sexual response. Okay, so if we think a little about the underlying issues, the cosmetic surgeons who profit from cosmetic surgeries emphasize women's agency, as do advertisers. Any attempt to restrict these surgeries is intruding on women's right to choose. The negative emotions of the patient provide the justification for the surgery. The positive emotions of the patient are a main measure of the success of the surgery. Now, feminist psychoanalyst Susie Orbach, it was reported in a panel discussion, was visibly torn between two doctrines. Her belief in female empowerment and body ownership conflicted with the sense that women's aspirations were being shaped by an unhealthy, masculine view of beauty. However, when pressed, she came down against cosmetic surgery, favouring therapy as the ideal treatment. Now, there's quite a lot in that, and one of the things that comes through very strongly is that there's a shift going on in the UK away from a vision of cosmetic surgery as something that people who are in some way psychologically vulnerable or damaged have performed on them. Now, there's an interesting article which shows that the same shift occurred in the USA somewhat earlier, so it was more or less complete by the 1970s, and with the same PR input through women's magazines as has been occurring through reality TV in the UK over the last 15 years. Okay, so those opposed to the surgery struggle to balance awareness of structure with acceptance of women's agency. And I think one of the things we need to think about in relation to this is that feminism can be different things. A radical movement challenging women to change, or a research and support system finding out about and walking alongside women. We find both those things in the literature. And I think they're both very different versions of what feminism should be doing for women, and they have different solutions when we think about in the tension between structure and agency. Okay, so what changes made demand for FCGS possible? I'm going to divide this into periods and themes. Okay, so in the 1880s to 1914, what we find is monogamous marriages broken by death or desertion of a spouse were the norm. Sexual and reproductive knowledge and genitals were shameful and hidden. Ignorance and lack of control over fertility caused much sexual distress. However, accounts of young unmarried people petting or fondling each other's bodies go back for centuries. Lengthy mutual petting, like masturbation, developed women's and men's awareness of their body's sexual response, combined with the absence of norms, which that absence existed as a consequence of the hidden nature of sexual activity, even within marriage. Combined with the absence of norms, this gave the potential for discovery of personal sexual sensations and emotions. Now, that didn't always happen. There's a lot of very unhappy stories about sexuality in this period, but nonetheless. Okay, thinking about hygiene, only the wealthy had bathrooms or running hot water. The association of dirt with disease fused with anxieties about sexuality in this period, reinforced by very high rates of syphilis. So genitals were dirty. Being seen to be dirty was increasingly shameful, lower class, and might expose a person to taunts and to being seen as ugly. Engaging in more demanding, not yet fully established hygiene practices was innovative, modern, established status, gave righteousness, and was seen as more beautiful. So images of genitals. Mirrors were luxuries, and women rarely saw their own naked bodies, let alone their genitals. No other images of genitals were available to respectable girls and women. Competition between girls and women. Now, there's a tendency to see things like cosmetic plastic surgery as being imposed upon women by men. I don't think that's what's really going on most of the time. The deciding event in most women's lives was if and who she married. Cultural norms of beauty in this period, while important, were little more than loosely defined archetypes. Young unmarried women were not competing with men, they were competing for men. The status of wife, mother, and housekeeper was stable and enduring. Young women's comparison of themselves with other women is fundamental to the development of body norms and ideals. Okay, so sexual practices. The growth of birth control in the period from the 1920s to the 50s enabled relaxation of the prudish sexual culture. There was a huge growth in female confidence following World War I, and what had been radical ideas about women's capacity and their right to make choices became common sense for the younger generation, who rejected, to a considerable extent, female submissiveness and sacrifice to duty. Young women, especially in the US, connected female heterosexual expression with defiance and pleasure, while feminism was associated with the sexually repressive Victorian sensibilities of most older women. In terms of hygiene, this is when the body as a project begins. There's a whole range of new products that had not previously been available to purchase. Advertisers appropriated feminist rhetoric. They claimed that modern, emancipated women exercised their new agency by choosing new products, often with claims purporting to be from medical authorities. Women's use of their vagina begins in this period. Lysol and other douches were promoted in the USA for feminine hygiene, which was a covert means of referring to birth control, which was illegal in the States at this time. By 1940, vaginal douches were the most widely used method by US women in all classes. Lysol, a caustic disinfectant, also used for cleaning the home, caused injury and even deaths, if not properly diluted. There are considerable attempts to publicise this, had little success because the resources of those doing so were limited and they had little support from regulators. Existing anxiety about hygiene primed women to accept that strong disinfectants were required to make the vagina clean. Okay, so norms around the look of the vulval area still did not exist in the interwar period. Pornography was limited and expensive. Men's and nudist magazines did not show genitals. Cultural expectations of naked bodies were based on classical Greek and Roman statues, white and smooth, firm and hairless. Okay, so the genitals' lack of clear definition of boundaries, form and colour is contrary to these criteria. No positive cultural framework into which to situate even the genitals of white women, while no positive cultural framework exists in which to situate even the genitals of white women, while those of other ethnicities were excluded de facto. Okay, so competition. From the 1920s, women's magazines presented exhortations to improve and excel at the business of being a woman, a wife and mother. Individual achievement and self-determination, as well as emotional control, were presented as central to the cult of femininity. Now, it's easy to imagine when we think about some of the kind of discussions of housewives in the 1960s that there wasn't this kind of pressure, but there quite clearly was, coming from magazines, a competitive pressure. Most occupations were still sex segregated, and in the workplace as in the home, women were competing with other women, not with men. Okay, 1960s to 1990s, sexual practice. The pill radically transformed sexual mores. The result was sexual practice more closely focused on sexual intercourse and other acts. There was no longer a need for petting to avoid intercourse and the risk of pregnancy. There's no evidence that I can find suggesting men had an appetite for doctored female genitals, or indeed for hairless pubes. But where a new trend was established by desirable and high status women, according to whatever criteria, men would incorporate this into their desire. Now, surveys show average numbers of sexual partners rising sharply through to the 1990s. Historically, the dominant role of the male in sexual activity was a given. But pleasurable sexual activity had also been strongly associated with privacy, trust, and intimate emotion, especially for women. High turnover of partners means trust and getting to know each other is no longer so central to sexual activity, and the female body can be experienced as an object to be looked at by the other, rather than a source of feelings and sensations of touch while fondling in the dark. Hygiene, the female body as a project, intensifies with a growing range of products, and emphasis on dieting and improved incomes in this period. But the body project and intensive hygiene is contested by hippies and radical feminists. Germaine Greer fiercely rejected vaginal deodorants and the claim that female genitals smell. In the late 1990s, however, we see the removal of traditionally erotically arousing pubic hair. Work on hair, including normalization of dyeing grey hair, was a central component of the trajectory of increasing body work. White, higher income women, more highly educated, whose bodies conform most easily to the classical beauty ideal, took the lead in removing pubic hair, and they also appear to be taking the lead in FCGS. Okay, images. The earliest claimed appearance of pubic hair was in Penthouse, but Hustler published the first pink shots of labial flesh in 1974. However, explicit images largely remained the province of illegal pornography until the 1990s, when the internet emerged. In the 1970s, the women's liberation movement, a small number of anti-capitalist young women began encouraging women to use a mirror, and if they had access to one, a vaginal speculum to look at and into their own genitals. Our Bodies Ourselves brought genital self-examination to a larger audience, selling 2.5 million copies by 1976, which staggered people at the time. I mean, they'd anticipated selling a few hundred when they started out. But, however, Playboy alone sold 5.6 million copies in 1975. The women's liberation movement had no resources other than collective commitment and ideas that spoke to their audience. Mainstream men's magazines are a well-capitalized, high-profit industry. it's difficult to overestimate the importance of the limited resources available for spreading new ideas that were not consistent with advertising messages or mainstream institutions. The women's liberation movement also began to produce art challenging the cultural construction of women's bodies. But there's very little imagery of actual vulvas or labia in any of the feminist art of the 1970s, which I've been able to find. Okay, so by the late 1980s, however, there was a new awareness of looking at women's bodies across a wide spectrum of culture, but actual genitals largely remained unseen. Genital piercing, however, was initially taken up in the late 1980s by young women who rejected conventional femininity, and often conventional, by then, feminism. Older female scholars have felt that decoration of the genitals transgressed natural divisions of private and public. But I would suggest this was a sign that these divisions had broken down in these young women's lives. And if we look at competition, divorce rates were rising sharply and casual sex and serial relationships were becoming more acceptable for young women. Competition between sexually active women, which had been confined largely to a brief period of courting, could now become a lifelong project. Second wave feminism rapidly became a broader movement from the late 70s, led by women with aspirations to succeed in the existing man's world, not to change society. This conventional feminism was powered by the competitiveness, and continues to be, that women had internalized over the past century and has reinforced body norms. Okay, so to look at from the 2000s, the sexual culture of young and or single women has largely moved from repressive insistence on sexual ignorance of young women toward a performance-oriented, semi-public activity that leaves sexually active women feeling exposed to male judgment. And I'm saying this partly on the basis of what the kind of research that's coming out of universities about what's happening to young women in universities. The trajectory of even more intensive management of the body is being maintained. Pubic hair removal has been normalised to quite a considerable extent. And assessment of labia is being normalised. So actually having the operations is still very rare, but the concept of assessing the labia and deciding whether they're normal or not is becoming increasingly common. Competition appears to be ubiquitous in young women's lives: academic, sporting, social activity, hobbies, cooking, their bodies. So really we see people who have very little areas where there is not some element of perceptions of success or failure operating. A recent UK report suggested the costs of eating disorders and obesity have been assessed in terms of present and future expenditure to the NHS and opportunities lost for young women. No costing exists of the ubiquitous breeding of body insecurity, which takes form in the growth of appearance, anxiety, body dysmorphia, bulimic behaviours, compulsive eating and confidence issues, many of which are now normative and widespread. The anxieties aroused by the cosmetic surgery industry promotion of FCGS are in addition to this list. And you'll note that there's actually, that report didn't really cover anything to do with sexuality. Okay, however, there are reasons for optimism. There has been development of a multifaceted discourse rejecting the sexual and hygienic rationales for a further extension of prescriptive body norms to include the genitals. Female medical professionals, academics and feminists have joined together in a variety of actions over the last 15 years. And I've got some relevant websites there for those who are interested. Okay, so I'd just like to finish by, how much time have I got? Oh, fantastic. Okay, I'll read my entire conclusion. I wasn't expecting to do this. Okay, this is some imagery, some recent imagery of vulvas, as the Americans call them, created on the left. We have craft created by women in the 2010s and the watercolours above. The two pictures listed in casting vulvas are art projects undertaken by men who were actively trying to reject genital surgeries, I tend to feel they don't really succeed in the sense that they're not really presenting positive images of vulvas, whereas if we look at the craft work, I think we get a much livelier, more positive sense of that will enable women to see their bodies perhaps in more interesting ways. But I'll be curious as to what other people think of that. Okay, so the fundamental change that I think has taken place over the 20th century is not in women's impulses or feelings about their bodies, but in the intensification of the technologies and the changes in the sexual context. The successful and confident English novelist Winifred Holtby commented in 1935, quote, "So powerful, so skillful, and so universal is the propaganda of advertisers, stirring our most sensitive secrets, that I think she must be a robust woman who is not occasionally stricken by some qualms." Now, I think that if someone like this could feel this so early, we need to look at solutions beyond the immediate. And the most interesting research I've seen is that by a woman, Rasheen, who looked at what women who had had cosmetic surgery said about their childhoods and their body image in their childhoods and how they'd experienced growing up with their body, rather than the really considerable amounts of research looking at the decision-making process that takes women into cosmetic surgery. Okay, so I'd like to conclude by saying, once again, FCGS operations are taking place in a small and crowded section of the female body on highly complex organs and tissue. Female sexual response involves mind-body emotion interactions about which surgeons know very, very little, and which are usually beyond the conscious control of the woman. In the supposed cause of improving women's sexual function by making them feel better, surgeons are scarring and destroying sexually responsive tissue. There has been development of a multifaceted discourse rejecting the sexual and hygienic rationales for a further extension of body norms. This holds out some hope that women will reject the chewed up stumps left when surgeons have finished slicing and stitching away at their labia minora and the other mutilating operations in favour of their own delicious, plump, colourful and sexually responsive genitalia.
Glad we could have the final flourish. So now we'd like questions from the floor, and because it's not quite hooked up yet, if you could keep your questions short and give us your name, and then Hera's going to repeat them for the people who are watching online. Who's a bit more able-bodied than me that can.
Can you say more about the research looking at women's childhoods with their common themes?
Jude has asked if I could say more about the research looking at women's childhoods were their common themes. I think the interesting thing about the common themes is something that you can observe through the whole century, which is the kind of progressive ideals, rejecting bullying, rejecting teasing, supporting positive sexual education, all come through again and again as things that would have benefited young people, young women. I'd comment again from other research that there's also research showing that young women who are brought up to be comfortable with nudity and with their own body tend to have a stronger level of sexual confidence as adults.
I was wondering if you thought the increase in sexual satisfaction as a result of this labiaplasty supposedly was actually from increased just sexual confidence because they feel they now get the norm.
Sorry, who are you?
Freya.
Freya. Freya asked if I thought that the increase in sexual confidence expressed by the women who'd had the surgeries was because they now feel they fit the norm. Yeah, very definitely. And in fact, there's a whole issue around the broader kind of research on other cosmetic surgeries, which says that what a lot of women's aspirations are is to pass, is to look normal. They're not actually hoping to be particularly beautiful. They just want to feel that something they experience as a defect has disappeared. So I'd say that when we think about sexuality and we think about the interaction with emotion, that actually greater confidence could have an impact.
And just a little adjunct into that, does sexual satisfaction then derive from that increased sexual confidence? Is it not actually due to anything that's physically developed for them?
Sorry, could you repeat that?
Sorry, is the increased confidence, does that internally to increase sexual satisfaction, is it not actually derived from some kind of increased sensitivity due to the surgery?
You mean physical sensitivity?
Yeah.
Not at all. I don't see any way in which it possibly can be.
So it would be derived from increased confidence rather than.
I think so, and also I think that you know, there's strong literature suggesting that the relationship with the person who has performed a treatment is important in the outcome. And women in other contexts, I haven't seen research on the genital cosmetic surgeries in this context, but in other contexts, they talk with enormous enthusiasm about how lovely their cosmetic surgeons are.
Chat here and then.
I'm hesitant to speak because I'm a plastic surgeon.
Delighted to see you here.
I'm head of department at the Heart Hospital, and I'm on the council of the New Zealand Association of Plastic Surgeons. And I'm just wondering whether, given the information that you've derived, you feel there should be a legal standpoint, either worldwide or in New Zealand, relating this to cosmetic, to female genital mutilation.
Oh, look, that question comes up quite often. Sorry, the question from the gentleman who's a plastic surgeon in Hutt Hospital was, did I feel that there should be a legal situation relating this to female genital mutilation? That question has come up quite often. It's been expressed very strongly by, I'm sorry, I can't remember his name, a British parliamentarian, black parliamentarian. And I would tend to feel that it would be difficult to achieve that, but female genital mutilation exists across a wide range of surgeries, from very extreme to relatively minor modifications. And I would tend to feel that there's a kind of arrogance in us feeling that what we're doing is fundamentally different to what is being done in these cultures that we are deriding and rejecting for this behaviour. So I guess I would tend to feel that if we are going to have a strong response to female genital mutilation, as we should and must, then yes, we probably should be trying to limit this type of surgery here. I think it would be difficult.
Times within certain parts of feminism, in their desire to resist things like FCGS, there's often quite, or just regular, other types of cosmetic surgery, there's often quite a misogynistic response to the women having them, as though it's kind of blaming them for their personal inability to resist all the patriarchal conditioning, and like, oh, this bitch is just deluded, and getting cosmetic surgery was a traitor to feminism or whatever. And I'm wondering, because I think as a friend once said, feminism is what we do together, everything else is just survival strategies. I'm wondering how we create resistance to certain types of cosmetic surgery that don't end up taking on individual women who have them.
Sorry, I'm just trying to think how to summarise that question, Anne. So Anne suggested that there's that women who are feminists can express negative and unkind responses to women who have had, you didn't say unkind, I know someone, responses to women who've had cosmetic surgeries, and that we need to find, can we find a way of rejecting these surgeries without rejecting the women who have had them as feminists? Yeah, look, I think it's really like obesity. I was thinking a lot about the analogies with obesity, because the whole kind of structure agency divide, the enormous difficulties people have in changing their food tastes and their feelings about food once they're adults. You know that our food tastes are settled in childhood. I think really we have to look at it as a structural problem, and these surgeries as part of that bigger structural problem with women's bodies and women's perceptions and experience of their bodies, and think about where the solutions are at that level. And I do think that people like myself have to be prepared to say, no, we think these surgeries are wrong and they shouldn't be happening. But I certainly don't think that anyone should be condemning individuals for the choices that they've made.
Sounds like a good note to end on, unless anyone else has got a burning question. Last gentleman at the back.
Yeah, just a question came to my mind. Is this solely an experience of heterosexual women, or does this sort of surgery occur for homosexual women as well?
The gentleman up the top asked whether this experience is solely the experience of heterosexual women, or whether lesbians would be having these surgeries as well. The answer is, I haven't got a clue. I hope not, but who knows? I haven't seen...
Lots of things to find out. Well, I'd like to thank you, Hera, yet again, that really interesting aspect of historical accounts that looking at gender and sexuality, and particularly so historical gender and sexuality, all things we don't hear talked about much here, and I thought that was a very fine and interesting account. For those of you who are interested in the New Zealand version of this and haven't been to the Te Papa opening of the new art gallery, there's a wonderful exhibition by the Pacific women of using shells to create the vulva in various really interesting ways around the body. So it's very playful, and it's very aesthetic, and it's really interesting. So they're at least as interesting as the ones up there. So recommend that you go. And indeed the form of the shell and the cowrie shells are really interesting in that regard. Thank you very much for coming. Thank you for a very stimulating address, and can we give Hera a clap? Thank you.
Thank you all for coming. Sorry, yes.
And there are all these things as how the exhibition today sold in the shop like bag badges and things like that. And my little brother took a photo of a couple of the things, and one was like him holding up but the other he was more like yes. My friend was like